Welcome to the Deep Dive. Today, we're going to be taking a journey through the world of healthcare management,
Yeah.
using your syllabus and lecture notes as our roadmap.
Okay.
Get ready to discover the inner workings of hospitals and health systems,
All right.
and gain some valuable insights you can apply to your studies and your future career.
It's incredible to see how this field has evolved, from ancient practices to the complex systems we see today.
Right.
It's a story of innovation and adaptation
Yeah.
and the constant pursuit of better healthcare for all.
Okay, so let's unpack this,
Yeah.
starting with the trip back in time.
Okay.
We're talking ancient Egypt, mummies,
Mhm.
and the very beginnings of medicine.
Wow.
Did they actually learn about anatomy through mummification?
Well, while their primary goal was an anatomical study,
Right.
the intricate process of mummification did give them a unique understanding of the human body. Think about it, removing organs,
Yeah.
preserving tissues that requires a certain level of anatomical knowledge.
It's amazing to think that those early practices laid the foundation for what we know today.
Right.
And it wasn't just the Egyptians,
Yeah,
right?
yeah.
Other civilizations were making strides too.
Absolutely. The ancient Indians developed Ayurveda, a holistic system that emphasized balance and natural healing.
Okay.
Many of its principles, like the focus on preventative care and personalized treatments, still resonate in modern healthcare approaches.
That's fascinating. It's like ancient wisdom meeting modern science.
right.
And of course, we can't forget the Greeks.
Yeah.
They gave us Hippocrates, the father of medicine,
Yes.
and that famous oath that still guides ethical medical practice today.
The Hippocratic Oath is a cornerstone of medical ethics,
Right.
emphasizing the physician's duty to act in the best interests of the patient.
Right.
It's a reminder that healthcare is about more than just treating diseases. It's about treating people with compassion and respect.
Speaking of treating people, the Romans were ahead of their time when it came to public health.
Oh, yeah.
They built aqueducts for clean water,
Yeah.
public baths for hygiene,
Right.
and even had a system of public hospitals.
You see the echoes of Roman ingenuity in our modern public health infrastructure,
Yeah.
from water treatment plants to vaccination campaigns.
Mhm.
They understood that a healthy population is the foundation of a thriving society,
Right.
a concept that remains as relevant today as it was centuries ago.
It seems like after those early civilizations, progress slowed down a bit.
Right.
Was the Middle Ages a dark age for medicine?
In Europe, yes.
Okay.
But the torch of medical knowledge was carried by Islamic scholars
Okay.
who made significant contributions in areas like surgery,
Huh?
ophthalmology, and pharmacology.
Okay.
Their work was later translated
Right.
and helped reignite medical progress in Europe during the Renaissance.
So it was like a relay race.
Yeah,
With different cultures passing the baton of medical knowledge through the ages.
exactly. And that brings us to the 18th and 19th centuries, a period of revolutionary breakthroughs.
Okay.
The development of the germ theory of disease, the introduction of anesthesia, and the use of antiseptics
Right.
transformed medical practice and dramatically improved patient outcomes.
These were real game changers.
Yeah.
Imagine undergoing surgery without anesthesia.
Oof.
It makes you appreciate how far we've come.
Absolutely. And the 20th century saw an explosion of medical advancements.
Right.
Antibiotics conquered infectious diseases.
Right.
Organ transplantation became a reality.
Yeah.
And genetic engineering opened up new frontiers in treating and preventing diseases.
It's mind-boggling to think how much has changed in just a century.
It is.
And all this progress has led us to the complex healthcare landscape we see today.
Yeah.
We have this intricate network of organizations,
Yeah.
each with its own purpose and structure. Where do we even begin to understand this system?
Well, a good place to start is by understanding the different types of healthcare organizations.
Yeah.
Broadly speaking, we
Yeah.
have public,
Yeah.
private, and integrated delivery systems.
Right.
Each plays a distinct role in providing healthcare services to the population.
Let's break it down.
Okay.
What exactly are public healthcare organizations?
Think of public healthcare organizations as the safety net of the system.
Okay.
These are typically government-run hospitals and primary health centers funded by taxes.
Right.
Their mission is to provide affordable and accessible care to all citizens,
Okay.
regardless of their ability to pay.
So they're all about serving the community,
Yeah.
ensuring everyone has access to basic healthcare services.
Exactly.
Okay.
Now, private healthcare organizations, on the other hand,
Yeah.
can be for-profit or not-for-profit
Right.
and cover a wider spectrum.
Yeah.
You have everything from small clinics run by individual doctors to Large corporate hospital chains with state-of-the-art facilities.
So private organizations provide more choice and specialization,
Yeah,
but they might come at a higher cost.
that's generally the case.
Okay.
Private organizations are driven by different factors,
Right.
including market forces and the need to generate revenue.
Mm-hmm.
They often offer a wider range of services and cater to patients seeking specialized care or a higher level of comfort and amenities.
Then there are these integrated delivery systems, the HMOs and PPOs we often hear about.
Yeah.
What are they all about?
Okay.
And how do they fit into the picture?
Integrated delivery systems, or IDS,
Okay.
are networks of healthcare providers working together to deliver coordinated care.
Right.
Think of them as a team approach to healthcare, with different specialists and facilities working together to provide comprehensive care for patients.
It sounds efficient.
It is.
But what's the difference between an HMO and a PPO? I always get those confused.
Think of it this way. An HMO,
Okay.
or health maintenance organization,
Right.
is like joining an exclusive club.
Okay.
You pay a fixed monthly fee
Mm-hmm.
and get access to a network of doctors and hospitals within that HMO. The focus is on preventative care and keeping costs down.
So it's like a subscription service for healthcare,
Yeah,
but you're limited to their network.
exactly.
Yeah.
Now, a PPO,
Right.
or preferred provider organization,
Okay.
gives you more flexibility.
Okay.
You still have a network of preferred providers,
Right.
but you can also see doctors outside that network, though it will typically cost you more.
It's like choosing between a curated menu with set options
Yeah.
and a buffet where you have more choices,
Yeah.
but pay for what you select.
That's a good analogy.
Yeah.
It really depends on your individual needs and preferences.
Right.
Do you value affordability and coordinated care,
Mm-hmm.
or do you prioritize flexibility and choice?
Makes sense.
Right.
So we've got these different types of healthcare organizations.
Yes.
But how do they actually function? I mean,
Right.
running a hospital seems incredibly complex.
It definitely is. Let's imagine a private hospital chain
Okay.
wanting to expand into Tier 2 cities in India. Yeah. They would need to understand the unique challenges and opportunities of those markets.
Like what kind of challenges?
No.
It can't be as simple as just building a hospital and expecting patients to show up, right?
Right. First, there's understanding the local needs.
Yeah.
What are the prevalent health issues in that region?
Okay.
What are the community's expectations regarding healthcare costs and accessibility?
It's like doing market research, but for healthcare.
Yeah.
You can't just assume that what works in a metropolitan area will translate to a smaller city.
Exactly.
Yeah.
And then there's the task of building trust and reputation.
Right.
They're entering a new market
Right.
where they may not be well known,
Mm-hmm.
gaining the confidence of the community.
Okay.
And building relationships with local healthcare providers is crucial.
Not to mention the logistics of finding qualified doctors, nurses, and administrative staff
Oh, yeah.
willing to relocate or join a new setup.
Yeah.
Talent acquisition in healthcare is a challenge everywhere.
Absolutely. And then there's navigating the regulatory maze.
Right?
Healthcare is a highly regulated industry,
Yeah.
and each state or region has its own set of rules and requirements.
Mm-hmm.
Plus, there's the financial side of the equation, managing costs,
Right.
generating revenue,
Mm-hmm.
and ensuring long-term financial sustainability.
Right.
It's a delicate balancing act.
Okay, so we're starting to see how many layers there are to this.
It is complex.
It's not just about providing medical care.
Right.
It's about understanding markets,
Mm-hmm.
building trust,
Yeah.
managing resources,
Mm-hmm.
and navigating regulations.
Right.
It sounds like running a hospital is like running a small city.
It's a good comparison.
Yeah.
And to manage all this complexity, hospitals need a clear organizational structure
Okay.
and effective leadership.
Right.
We'll delve into that next.
All right, so we've laid the groundwork for understanding the history of healthcare
Okay.
and the different types of organizations involved.
Yeah.
Now let's dive deeper into the inner workings of hospitals
All right.
and see how they're structured to operate efficiently and effectively.
Sounds good.
Stay tuned.
Okay.
We just talked about how complex running a hospital can be.
Yeah.
It seems like you need a whole army of people just to keep things running smoothly.
That's true.
Right.
Think of a hospital as a massive ship.
Okay.
To navigate the complexities of healthcare, you need a skilled crew
Right.
with clearly defined roles and responsibilities.
Okay, so who's at the helm of this ship?
Right.
Who are the key players in a hospital's leadership structure?
At the very top, you have the governing board.
Okay.
Sometimes called the board of trustees or directors.
Right.
They're like the ship's owners.
Okay.
Setting the overall direction and ensuring the hospital fulfills its mission.
So they're the big picture thinkers.
Yeah.
Making sure the hospital stays true to its purpose and remains financially stable.
Precisely.
Yep.
They're responsible for things like approving budgets, setting strategic goals,
Right.
and appointing the CEO.
And the CEO, that's the captain of the ship. Right.
Exact.
They're responsible for the day-to-day operations.
Yeah.
And making sure everything runs smoothly.
The CEO is the top executive,
Yeah.
responsible for translating the board's vision into concrete actions.
Right.
They oversee all aspects of the hospital's operations, from patient care to finances to human resources.
But a captain can't run a ship alone.
Right.
What about the rest of the crew?
Right.
Who are the key players supporting the CEO and the board?
That's where the medical administrators and middle managers come in.
Okay.
They're the department heads.
Okay.
The nurse managers, the financial officers,
Right.
they're the ones who keep the ship running smoothly on a daily basis.
So they're like the officers and crew,
Yeah,
each with their own area of expertise and responsibility.
exactly.
Okay.
You might have a chief medical officer overseeing all clinical operations, a chief financial officer managing the hospital's finances, a chief nursing officer responsible for nursing staff and patient care,
Okay.
and so on.
Right.
Then within each department, you have middle managers
Right.
who oversee specific units or functions.
I'm starting to see how this structure works.
Yeah.
It's like a hierarchy with clear lines of authority and responsibility.
Yeah.
But what about when things need to change?
Okay.
Like if the hospital needs to adapt to a new regulation or implement a new technology.
That's when leadership and change management become crucial.
Okay.
Different leadership styles come into play,
Right.
depending on the situation and the organization's culture.
You hear a lot about different leadership styles,
Yeah.
like transformational leadership or servant leadership.
Yeah.
Do these actually apply in a hospital setting?
Absolutely.
Okay.
A transformational leader might inspire their team with a compelling vision for the future, driving change through enthusiasm and motivation. A servant leader might focus on empowering their team
Right.
and supporting their growth,
Okay.
creating a culture of collaboration and shared decision-making.
It seems like there's no one-size-fits-all approach to leadership in healthcare.
Exactly. Effective leaders adapt their style
Okay.
to the situation, the team, and the goals they're trying to achieve.
So let's say a hospital wants to implement a new electronic health record system.
Okay.
That's a major change.
Right.
How would a leader approach that kind of transition?
One widely used model is Lewin's change model.
Okay.
It breaks down change into 3 stages: unfreezing, changing, and refreezing.
Okay. I've heard of this model.
Yeah.
But how does it actually apply to something like implementing a new EHR system?
Imagine trying to reshape a block of ice.
Okay.
First, you need to unfreeze it.
Right.
Create a sense of urgency for change in the context of EHR implementation.
Yeah.
That means communicating the benefits of the new system,
Okay.
addressing staff concerns.
And building buy-in for the transition.
So you need to convince everyone that this change is necessary and beneficial.
Exactly.
Okay.
The next stage is changing.
Okay.
The actual implementation of the new system.
Right.
This involves training staff, testing the system,
Yeah.
and going live with the new EHR.
And the final stage, refreezing,
Yep.
is all about making the change stick, right?
Precisely.
Okay.
It's about solidifying the new processes,
Right.
providing ongoing support, and celebrating successes to reinforce the new way of working.
So it's not just about flipping a switch and expecting everything to change overnight.
Right.
It's about a carefully managed process
Yeah,
with a clear plan for implementation and follow-through.
exactly.
Right.
And remember, even with great leadership, change can be challenging.
Right.
You're dealing with people's habits, fears,
Yeah.
and resistance to the unknown.
It makes sense that implementing a new EHR system or any major change
Yeah.
requires a lot of planning. So,
Communication and support.
right.
It's not just about technology, it's about people.
You've hit the nail on the head.
Okay.
And that brings us to the various functions
Right.
that keep a hospital running smoothly on a daily basis.
Right. We were talking about this earlier.
Yeah.
All the different departments and functions that are essential to a hospital's operation.
Absolutely.
Where do we even begin?
Well, let's start with human resource management.
Okay.
It's a critical function in any organization,
Right.
but especially in healthcare.
Yeah.
You're dealing with a highly specialized workforce, a high demand for skilled professionals
Right.
and the emotional demands of the work.
It sounds like healthcare HR has its work cut out for them.
They do.
Yeah.
Think about it.
Okay.
Recruiting and retaining top talent.
Right.
Providing ongoing training and development,
Mm-hmm.
managing performance,
Yeah.
and maintaining positive employee relations,
Right.
all in a sector prone to burnout.
Yes.
It's a challenging but rewarding field.
It sounds like they need to be masters of motivation and employee engagement.
Absolutely.
What about the financial side of things?
Okay.
Healthcare costs are constantly rising.
Yeah.
So how do hospitals manage their finances and stay afloat?
Financial management in healthcare is like walking a tightrope.
Oh, wow.
You have to control costs,
Right.
create realistic budgets,
Mm-hmm.
generate revenue,
Yeah.
and adapt to ever-changing reimbursement models
Right.
from insurance companies and government programs.
It's a lot more than just collecting payments and paying bills.
Absolutely.
Right.
They need to analyze financial data,
Okay.
negotiate contracts,
Mm-hmm.
manage investments,
Right.
and make strategic decisions
Okay.
to ensure the hospital's long-term financial sustainability.
And what about operations management?
Okay.
What does that look like in a hospital setting?
Operations management is the engine room of the hospital.
Okay.
It's about improving processes,
Right.
managing resources,
Mm-hmm.
ensuring quality assurance for patient care. Right.
And squeezing maximum efficiency
Right.
out of every aspect of the operation.
So they're the ones making sure everything runs smoothly,
Huh.
from patient admissions to surgical procedures to discharge planning.
Precisely.
Okay.
They're constantly looking for ways to improve patient flow,
Mm-hmm.
optimize resource utilization,
Yeah.
and streamline processes to deliver the best possible care
Right.
while keeping costs in check.
It sounds like a never-ending puzzle, finding ways to do things better, faster, and more efficiently.
It is.
And we can't forget about marketing and public relations. In today's competitive landscape,
Yeah.
hospitals need to build a strong brand,
Uh-huh.
attract patients,
Right.
manage their public image,
Mhm.
and communicate effectively with the community.
Right.
So it's not just about providing great care,
No.
it's about letting people know about it
Uh-huh.
and building a positive reputation in the community.
Exactly.
Okay,
They need to understand their target audience.
develop compelling marketing campaigns,
Okay.
manage media relations,
Right.
and ensure a consistent brand message across all channels.
It's like they're running a business within a business.
You could say that.
And of course, in this digital age,
Right.
we can't overlook the role of information technology.
Yeah, absolutely not.
IT plays a transformative role in healthcare,
Yeah.
from managing electronic health records
Mm-hmm.
to ensuring data security
Right.
to implementing telehealth solutions.
Yeah, it's a big piece.
It seems like IT is becoming increasingly important in healthcare.
Absolutely.
Right.
IT is no longer just a support function.
Mm-hmm.
It's a strategic partner that helps hospitals improve patient care,
Right.
enhance efficiency,
Okay.
and innovate in a rapidly changing landscape.
So we've covered a lot of ground here. Different types of healthcare organizations,
Mm-hmm.
leadership structures,
Yeah.
change management,
Mm-hmm.
and the key functions that keep hospitals running. It's clear that managing a hospital is a multifaceted and complex endeavor.
It is,
Right.
but it's also incredibly rewarding.
Yeah.
Seeing the impact that hospitals have on people's lives
Mm.
makes all the challenges worthwhile.
We've talked about the different players in healthcare,
Mm-hmm.
how hospitals are structured,
Yeah.
and all the functions that keep them running.
Yeah.
But to really thrive in today's dynamic environment,
Right.
hospitals need a roadmap for the future. That's where strategic planning comes in.
Right, absolutely. Strategic planning is essential for any successful organization,
Right.
especially in a field as complex and ever-changing as healthcare.
Mm-hmm.
It's about looking ahead,
Okay.
anticipating challenges,
Right.
and making informed decisions to ensure the hospital's long-term success.
So it's not just about keeping the lights on and the doors open.
Right.
It's about having a vision for the future
Yes.
and a plan to get there.
Exactly. Strategic picking helps hospitals adapt to new technologies, changing patient demographics,
Mhm.
evolving regulations,
Right.
and the competitive landscape of healthcare.
It sounds like there's a lot to consider.
It is.
How do hospitals actually approach this process?
Well,
Where do they even begin?
One common framework is the SWOT analysis,
Okay.
which stands for strengths, weaknesses, opportunities, and threats.
I see.
It's a way for hospitals to take a comprehensive look at their internal and external environment.
So it's like a strategic self-assessment,
Yeah.
figuring out where they excel,
Uh-huh.
where they need to improve,
Right.
and what's happening around them.
Precisely.
Right.
They start by identifying their internal strengths,
Right.
what they do well, their unique resources,
Right.
and their competitive advantages.
Right.
Then they look at their weaknesses, areas where they need to improve,
Right.
resource limitations,
Okay.
or processes that aren't working efficiently.
It sounds like a pretty honest and sometimes difficult conversation to have.
It can be,
Yeah,
but it's probably necessary to get a clear picture of where they stand.
absolutely.
And it's not just about looking inward, they also need to analyze their external environment.
Yeah,
That's where opportunities and threats come in.
exactly.
So opportunities would be things like emerging trends,
Yes.
new markets,
So-
or advancements in technology that they could leverage for growth.
Exactly.
And threats would be things like changes in regulations, new competitors entering the market,
Right?
or economic downturns that could impact their financial stability.
Yeah.
It's starting to make sense. You have to understand your own strengths and weaknesses.
Right.
And then you have to be aware of what's happening around you to make informed decisions.
Exactly. Let's say a community hospital is facing increasing competition
Okay.
from larger healthcare systems.
Right.
Their SWOT analysis might reveal strengths,
Okay.
like strong community ties, a loyal patient base,
Yeah.
and a dedicated staff.
Okay.
But they might also identify weaknesses.
Like outdated facilities,
Uh-huh.
a limited range of specialized services,
Okay.
and difficulty recruiting specialists.
So how do they use this information to develop a strategic plan?
Well,
It sounds like they have some real challenges to address.
first, they need to define their vision.
Okay.
Where do they want to be in the future?
Right.
It's a statement that captures their aspirations and guides their decision-making.
Okay.
Then they develop a mission statement,
Okay.
a clear and concise articulation of their purpose,
Right.
why they exist, and what they hope to achieve.
So the vision is like their ultimate destination.
Yes.
And the mission is the roadmap that guides them there.
Exactly.
Oh.
And to make those aspirations a reality,
Right.
they need to set specific, measurable goals.
Okay.
These aren't vague statements like, we want to improve patient care.
Right.
They need to be concrete objectives like,
Okay.
reduce hospital-acquired infections by 15% within the next year.
Okay, so they've got their SWOT analysis,
Yeah.
their vision, their
Yeah.
mission, and their goals.
Uh-huh.
What happens next? How do they actually put this plan into action?
That's where action plans come in. They
Okay.
need to develop specific strategies and initiatives to achieve those goals.
Okay.
This might involve investing in new technology,
Right.
expanding their service offerings,
Oh, yeah.
forming strategic partnerships, or streamlining their operations.
So they're translating those goals into concrete actions.
Right.
Figuring out what needs to be done
Uh-huh.
and who's responsible for doing it.
Exactly.
And the final piece of the puzzle is implementation and control.
Yes.
They put those action plans into motion,
Yeah.
allocate resources, assign responsibilities,
Right.
track progress,
Uh-huh.
and make adjustments as needed.
Right.
It sounds like an ongoing process,
It is.
constantly monitoring and evaluating to make sure they're on track.
Strategic planning isn't a one-time event. It's a continuous cycle of assessment, planning, implementation, and evaluation.
Okay.
And it's closely tied to another critical aspect of healthcare management,
Right.
quality improvement.
That's right. We were talking earlier about all the different functions in a hospital.
Yes.
How does quality improvement fit into all of this?
Quality improvement is the heartbeat of any successful healthcare organization.
Okay.
It's about constantly striving to enhance patient safety, satisfaction, and outcomes.
So it's not just about avoiding mistakes.
Right.
It's about actively seeking ways to do things better,
Yes.
to provide the best possible care for every patient.
Exactly. And there are various methodologies hospitals use
Great.
to guide their quality improvement efforts.
Right.
You've got Lean,
Okay.
Six Sigma, root cause analysis,
Okay.
and the Plan-Do Check-Act cycle.
Okay, let's break those down.
Okay.
What's the lean approach all about?
Lean is all about eliminating waste.
Okay.
Anything that doesn't add value to the patient. It's about streamlining processes, reducing delays,
Yeah.
and optimizing resource utilization to improve efficiency and patient flow.
So it's like finding ways to do more with less,
Yeah,
but always with the patient's well-being in mind.
exactly. Then you have Six Sigma,
Okay.
a data-driven approach that focuses on reducing variation and defects in processes.
So if lean is about streamlining,
Yeah.
Six Sigma is about perfecting.
You could say that.
Okay.
It's about using data to identify areas for improvement, developing solutions,
Okay.
and then monitoring the results to ensure those improvements are sustained.
What about root cause analysis?
Okay.
When would a hospital use that?
Root cause analysis is used when something goes wrong,
Like
like a medical error or a patient safety incident.
Right.
It's about digging deep to understand the underlying causes of the problem,
Okay.
not just the symptoms.
It's like being a detective, but for healthcare.
Right.
You're trying to find the root cause of the problem so you can prevent it from happening again.
Exactly. And finally, there's the Plan-Do-Check-Act cycle, a simple but powerful framework for continuous improvement.
That one sounds pretty self-explanatory.
It is.
Huh.
You plan a change,
Okay.
implement it on a small scale,
Right.
check the results,
Mhm.
and then act on those findings,
Right.
either by adopting the change more broadly
Yeah.
or going back to the drawing board.
It's about constantly experimenting, learning, and making incremental improvements over time.
Precisely. And all of these quality improvement methodologies
Right.
play a crucial role in ensuring hospitals meet ethical and legal standards of care.
That's right. We can't talk about healthcare management without considering the ethical and legal implications.
Right.
It's such a sensitive and important area.
It is.
Where do we even begin to unravel this?
Well, it starts with patient rights and responsibilities.
Okay.
Patients have the right to informed consent,
Right.
meaning they need to understand their diagnosis, treatment options, and potential risks before making decisions about their care.
Right.
They also have the right to privacy,
Right.
confidentiality, and access to their medical records.
And on the flip side, patients have responsibilities too, right?
Absolutely.
Okay.
Patients have a responsibility to provide accurate information
Okay.
about their medical history,
Mm-hmm.
to follow their treatment plan
Okay.
as prescribed by their doctor,
Right.
and to communicate openly with their healthcare providers.
Yeah.
It's a partnership,
Right.
a shared responsibility for ensuring the best possible outcomes.
It sounds like open communication and trust are essential in this relationship.
They are.
And then, of course, there are the legal requirements that hospitals must adhere to. There are laws and regulations governing everything, from patient safety to medical record keeping
Right.
to the handling of hazardous materials.
Yeah.
It's a complex web of rules and regulations.
It is.
But ultimately, it's about protecting patients and ensuring that healthcare is delivered safely and ethically.
Exactly. And as healthcare evolves,
Right.
so too do the ethical and legal considerations.
Right.
We're seeing new challenges emerge
Yeah.
with advancements like telehealth,
Okay.
artificial intelligence, and personalized medicine.
That's a great point.
Yeah,
It seems like technology is moving faster than the regulations can keep up.
it does sometimes.
Yeah.
How do hospitals navigate these uncharted waters? It's a constant challenge.
Right.
But hospitals often rely on ethics committees
Okay.
to help them grapple with complex issues and make difficult decisions.
Right.
These committees are typically made up of healthcare professionals,
Okay.
ethicists,
Mm-hmm.
and community members who provide guidance and support
Okay.
in navigating these gray areas.
So it's like having a moral compass
Yeah,
to guide them through those tough situations.
exactly.
And as we wrap up this deep dive into healthcare management,
Okay.
it's important to remember that this is a field that's constantly evolving.
Yeah, absolutely.
New technologies, new treatments, and new challenges are emerging all the time.
They are.
It's been an incredible journey,
It has been.
exploring the history of healthcare,
Mm-hmm.
the intricacies of hospital management,
Right.
the importance of strategic planning and quality improvement,
Yeah,
and the ethical and legal considerations that guide this vital field.
absolutely.
We've covered a lot of ground,
Yeah, we have.
but hopefully this deep dive has given you a better understanding of the complexities and rewards of healthcare management.
I hope so.
We encourage you to continue exploring this fascinating field,
It is.
whether you're pursuing a career in healthcare
Yeah.
or simply interested in learning more about how this vital industry works.
Right.
There's always something new to discover.
There is.
Thanks for diving in with us.
I appreciate it.